Did you know that Bryan The Anorexic Johnson has the drug cabinet of a 65-year-old? According to Claude, based on open source data from BJ's website and online disclosures, he is on 8 prescription drugs. These include Repatha, Tadalafil, Jardiance, Acarbose, Candesartan, transdermal testosterone, minoxidil, levothyroxine, and armour-thyroid. These are the drugs of a man in his mid-60s to mid-70s with cardiovascular disease, type 2 diabetes, hypertension, male pattern baldness, and erectile dysfunction. This is not the longevity protocol. This is a geriatric cardiology clinic discharge prescription. The patient is 47. The pharmacy says over 65. As Singapore's aging guru, my entire family has an old Mother Hubbard drug cabinet. We take 0 pharmaceuticals because our family physician says we have a completely clean bill of health. All drugs have side effects, none of them good. If you look at BJ's cardiac and neurological structural data, his own team acknowledges that they skew decades older than his chronological age. Again, 65 to 75-year-old range. Normal intracranial pressure is 7 to 15 mm mercury. BJ hides his number, but given that surgical intervention is under consideration, it must be out of range, meaning that he suffers from brain hypertension. This high blood pressure in his skull may help to account for his hearing loss. According to him, his left ear is biologically 64 years old and requires a hearing aid. I suffered some diagnosed hearing loss due to growing shit up as an army combat engineer, but not so much as to require hearing aids. I did an echocardiogram in 2024 at Singapore's National Heart Centre. I was 52 at the time. I was born in 1972 and BJ in 1977. He is chronologically 5 years younger. However, if you do a head-to-head comparison, his heart is 15 to 25 years older than mine was 2 years ago. BJ makes much of his unnaturally long telomere length. Apparently, he achieved this via HBOT treatment. Telomere shortening is a defense mechanism against cancer. Telomere length became famous as a longevity proxy because shorter than normal telomeres correlate to premature aging. Anything below 6 kb is associated with premature aging and increased disease risk. For healthy adults, 40 to 60 years old, range is 7 to 8 kb. Mine is 7.25 kb. However, anything more than 11 kb is an unambiguous oncology risk signal. At 11.7 kb, BJ is at elevated risk for lung, skin, colon, and brain cancer. This is a classic Goddard's law violation. When a measure becomes a target, it ceases to be a good measure. For example, if your Goddard's target is to lower LDL with a statin, and the statin causes a liver injury, then LDL is no longer a good measure. Longer equals younger is a logic fallacy and runs counter to Goldilocks range. You don't want it to be too high nor too low, but just right. Tadalafil, brand name Cialis, is an FDA-approved treatment for erectile dysfunction. Bryan The Anorexic Johnson started treating his Johnson in June 2023 and frames it as cardiovascular longevity medicine. He simultaneously claims the virility of a man in his 20s while on a daily ED drug, supplementing testosterone to counteract self-induced hypogonadism from extreme caloric restriction and injecting Botox and undergoing penile shockwave therapy. The anorexic body destroys male hormonal health. This is exacerbated by minoxidil, a systemic vasodilator which reduces libido and erection. BJ's 2.5 mg daily dose sounds low given his flaccid condition. Subject to official clinical diagnosis, prima facie, BJ meets the atypical anorexia nervosa DSM-5 ICD-11 criterion. His symptoms include 20 to 30% caloric deficit, less than 8% body fat, hypothermia, bradycardia, and 16-hour fast. At 105 ng per ml, his IGF-1 is also that of a 59-year-old. BJ meets all the criteria. A. Restriction of energy intake. B. Intense fear of weight gain, characterized by adversarial relationship with food. I quote, "Every calorie must fight for its life." C. Disturbance in body image. Project baby face, cosmetic restoration of gaunt face and rotten teeth. BJ's blueprint protocol is the most elaborate anorexia defense ever devised. Every negative indicator is spun as a positive. Every downstream consequence of restriction, testosterone suppression, facial fat loss, ED, immune impairment, poor wound healing, is reframed as a longevity intervention side effect rather than recognized as a starvation consequence. The justifications become more elaborate with each symptom. That elaboration is the diagnosis, not the defense against it. Do not fall for the smoke and mirrors. The Conrad Murray precedent. Dr. Conrad Murray, Michael Jackson's doctor, was convicted of involuntary manslaughter in 2011. A physician who subordinated clinical judgment to a wealthy patient's demands, using legitimate drugs for illegitimate indications, and faced criminal liability when the outcome turned fatal. I was following the patient's protocol. It's not a robust defense before a medical licensing board, and it wasn't a robust defense for Conrad Murray either. BJ's medical team appear with obscured faces on his social posts. The drugs in BJ's cabinet are correctly indicated for the conditions he actually has. That is precisely the point. His physicians are treating a genuinely sick over 65-year-old patient. He is marketing himself as the world's healthiest 18-year-old. The people administrating his protocol are systematically de-identified. You never see their credentials, their medical license numbers, their institutional affiliations. And they're all under draconian NDAs. Occult secrecy is the exact opposite of transparency. What other secret is BJ hiding? The obscured faces suggest his team understands the Conrad Murray precedent and has no wish to become equally infamous. Darwin Award 2027. BJ is facing a triple threat: heart attack, stroke, and cancer. 3 clear mortality fast tracks. And let's not rule out acute renal failure from the cumulative nephrotoxicity of consuming more than 100 pills a day, itself a polypharmacy violation. These are not the medical issues of an 18-year-old. At 18, my mom has none of these issues. Given these prognoses, which sane person who call themselves healthy, let alone the healthiest man in the world. Even marketing hyperbole has a limit. This is Joker level delusional. At 54, I need reading glasses, but I can spot a charlatan from a mile away. A fraudster to be debunked, an imposter to be unmasked. This is why BJ refuses to participate in any clinical studies. In contrast, Team De-Aging has participated in studies conducted by the National University of Singapore and Nanyang Technological University. Most recently, we were independently tested at the University Malaya Medical Center, and I started my longevity journey in 2018 by being tested at the Mayo Clinic, Rochester, Minnesota, USA. BJ, of course, refuses to participate in the Longevity World Cup because he can't gain it like his farcical rejuvenation Olympics. BJ, you are the walking dead. Instead of rearranging deck chairs on the Titanic, recant and reverse course immediately, or you will collide with the arrogant iceberg of your own creation. You will surely die, and a lot sooner than you think. You are a time bomb with a marketing budget. Be young.